Namaste. My name is Terrence Kommal. I'm a medical doctor, and I had the great pleasure of spending time with each of you, or many of you, during our stay in Sani Pass and the time that we spent preparing and returning from the Sani Pass journey. It was really, truly a great honor to spend time with some of you and some more time with others than the rest. This aim of this short discussion with you is to alert you to some of the suggestions the medical team and I are proposing. Up front, I'd like to make it very clear that the proposals I'm about to make are strictly voluntary. You don't have to opt into any of the suggestions. You don't have to opt into sharing any information or following through with any of these suggestions at this point, because it is only being suggested for your own well-being. Just for a little bit of background and for you to understand, when it comes to healthcare practitioners, particularly in doctors, each doctor has a different perspective and a different approach based on their experience, their appetite for risk, as well as their exposure in the world that they come from. I come from a world originally of military training. So I spent a significant time in the military. I was part of the disaster management teams. I was part of the mass casualty planning team for the World Cup 2010 and the presidential medical teams. So I have a low tolerance for risk, and I spend a lot of time in what they call the 5 Ps in the military. Prior preparation prevents poor performance, because in extreme environments, extreme circumstances require adequate planning and aggressive planning. And even if many of you and some of my colleagues may believe it's too much planning and too much preparation, I'd rather be over-prepared and not need to do anything afterwards, as opposed to being underprepared and being caught out unnecessarily, being poorly prepared and poorly ready for any eventuality, even as rare as it may be. In my primary training, I also spent many time in the specialist field of anesthesia and ICU. So I trained in anesthesia and spent a lot of time. Hence, I've seen a lot of things go wrong very quickly, and the need to be prepared for any eventuality is always there. So it's how I'm hardwired as a clinician. Again, the intent of this is not to create panic, but the intent is to alert you to some of my concerns that I have, that I've discussed in different ways at different times with the rest of the rest of my esteemed peers and medical team that's going with us on this trip. Traveling to Kailash is a great blessing indeed, but associated with it are significant risks. Let's be honest, and we've now established, given the time we've been in Sani Pass, I'm probably the youngest person attending on this trip, and most, if not all of the people attending are more than 60 years old. The reality is the Indian medical history, and I'm making broad sweeping statements, is most people have high risk family histories, high risk opportunities for chronic conditions. So many may be hypertensive, many may be hypertensive and diabetic, and some may already have pre-existing chronic conditions like arthritis, heart disease, and others. And these can significantly impact your ability to perform at these extreme environments. Yes, there will be ponies. Yes, we understand there will be ambulances and potentially an oxygen tank or two available. But it doesn't detract from the material risks that I believe that I've shared with my learned peers that may exist. The two key concerns are we're sending from Nepal to Tibet to a height of more than 4,800 meters in a single day, and we will have time to acclimatize. But associated with that, in terms of the guidelines of the United States, Center for Disease Control, Cleveland Clinic, and others, and in papers studied for studies and papers that were published right up to 2022, you need to, in an ideal world, ascend not more than 300 to 500 meters per day, unless you're prepared for extreme acclimatization, and then you're taking things like Diamox. Let me explain my understanding of Diamox. Diamox, otherwise known as acetazolamide, impacts your body's metabolic system. How does it work? Very simply put, is it causes the body to go into a condition called metabolic acidosis, which is a technical term meaning we trigger the body to have specific side effects and symptoms. The reality is acetazolamide is not prescribed by definition as an on-label use for altitude medical mountain sickness or high altitude conditions. It's an off-label use. Yes, the medical world has accepted it's useful, but it's registered use is for things like glaucoma and other medical conditions. So the off-label use has great benefit, but it's not also associated without risks. Because the mechanism, in my understanding on the data and the research that I've done, is Diamox triggers your body's metabolic acidosis, which causes the person or the individual taking it to hyperventilate. And by hyperventilating, it then causes you to take in more air as quick as you can. So it accelerates your body's absorption of oxygen in a low oxygen environment, typically the environments we anticipate during the yatra when we're together. But that also triggers another side effect, which is called diuresis. Simply put, it forces your body to pass more water and for you to urinate more water, which accelerates your risks of complications during dehydration. Now, in an ideal world, in a non-acute environment, that may be easily manageable. And it may be manageable in most people. But there may be specific individuals already have pre-existing lung conditions, heart conditions, may have issues with their hypertension, which they may or may not know is adequately controlled, their diabetes and others. And these are all interrelated issues. We cannot see them as standalone conditions. So when you take these medication, do they work? Yes, they do. Do they have side effects? Absolutely. So we need to be acutely aware of this. We also need to understand the environments we're in, because I haven't been there, and I think maybe only one or two of our group may have been there, is the fact that we may have an ambulance on standby doesn't mean it's going to go with us alongside with the ponies that take us to each site. If that's true, great. But then given the terrain that we'll be in a mountainous environment, if you need urgent evacuation in Tibet, the helicopters that we're told that we could have access to have no right to fly in Tibet. They can fly to the Nepal border because that's where they're licensed to. China will not allow any third-party operators to land a helicopter in the Tibet environment based on the research that I've done and the information I've received from the embassy. So if there is an emergency, we may have to rely on that individual being evacuated by pony or that individual being evacuated by the ambulance, wherever it's standing, to come and fetch you and then take you through that terrain back to a safe environment and or across the border for further medical interventions. Yes, I'm talking about extreme circumstances, but it's not an extreme when we have a population group with our group that we're going, which I have the great pleasure to travel with, that's more than 60 years old, which puts you into a moderate risk environment. And if you have pre-existing conditions, puts you into a high risk grouping. And according to the United States CDC, an ascent more than 12,000 feet in one day, given we're starting even at 1,000 feet, once you cross the barrier of 4 to 4,200 feet, you move into very high altitude environments, which acclimatization is good, given that we'll have 2 days. But the risks are always there of something going wrong. And the two major conditions that are the risks are things known as HACE, H-A-C-E, and HAPE, H-A-P-E. Very simply put, HACE is high altitude cerebral edema, which means a urgent condition in which there's potential risk to the neurology system in the brain, and HAPE, high altitude pulmonary edema, which through a complicated physiological mechanism in the body struggles to absorb oxygen, the airways start to close, and then you have the risk of getting fluid, loosely put, in the lungs, which accelerates the risk within hours of significant and urgent complications. Do they happen often? The answer is no. Can they happen in a higher risk group with chronic conditions? Absolutely. Do we want to worry about that risk? I think we should at least consider it. So given these conditions and the risks that may exist, I'd like to make the following suggestions, and I've consulted with some of my learned peers who are traveling with us, is firstly, we'd like to send you a form. And it's potentially going to be a digital form in which you can provide to us your medical background, your medical history, your current treatment, and some of any relevant information that you believe we may need. What we intend to do with this is bring a physical file with us for each of you as our patients. And our intent is not to supersede or interfere with your current treatment, with your current family doctor that you work with on a day-to-day basis or regularly. But given that we'll be in an extreme environment, I believe we shouldn't be blindsided, not knowing what may or may not exist as pre-existing risks in this extreme environment that we will be. Yes, it may be a few days, but it takes a few hours for things to go wrong. And I don't want to take that risk collectively with the wisdom of our team. Yes, there will be provision of these preventative medication of Diamox and others, but it does not mean that even with Diamox that things don't go wrong. conditions happen because you're in an extreme environment, and we need to anticipate the rare chance of things going wrong. So the medical history form is strictly optional. We will send a link to you, and that information will be treated in strictest confidence, as we do for any other patient's information. And the regular monitoring that will be done with the medical team will be then recorded against your medical chart, so we can monitor any trends, changes, and information that may be concerning or may not be concerning, to monitor your progress through the trip. The second suggestion is we will then propose that we send a blood form to each of you, and you could potentially use, as far as I understand, in KZN, as many of you are based in KZN, Lab 24 by Uncle Daya and others are very cost effective in their testing, but you can use any lab of your choice. What I am proposing we look at is we look at your kidney systems, your liver systems, your blood system, and some of the basic markers that could give us any indication early now of any risks that may exist. Because although you may feel well, although your treatment may be going well, there may be conditions that pre-exist that you may be unaware of, and so is your medical team. All I want to do, potentially, collectively with our medical team, is anticipate any risks. So if something changes, we must know you may have had a pre-existing kidney condition, so we know how to deal with it. The other significant concern is we're worried if some people may have anemia conditions, which is a massive risk condition to have in this high altitude environment, given that the biggest risk of the high altitude is the low oxygen concentration and the low oxygen availability in the air itself. So if somebody is anemic, we don't have the time to give you iron tablets at this point, or basic treatment to say it's going to take 6 weeks to 6 months to normalize. What may be warranted, and I'm not saying it will be warranted, is you then may need to take supplemental iron drips and other treatments that can optimize your body to reduce the risks of things going wrong in this extreme environment. I don't want to detract for the importance of our spirituality and our puja. And I had great discussions with Panditji about this. But the reality is Bhagwan also gives us these resources and knowledge to help each other, to make sure we make an active and concerted effort to act for ourselves, to care for ourselves and minimize our risks whilst we're there in that environment. So those two suggestions of the medical history and the lab forms are strictly optional. The third suggestion is, and I will be completely transparent, I'm doing the same for my mom, we will be carrying a portable oxygen concentrator. It's a little machine that's probably not larger than something about this size, which you have probably seen many people who have lung conditions walking in malls with a little thing that looks like a little old hi-fi from the 80s. It weighs about 1.5 to 2 kilograms. This is not meant for intentional treatment, because I'm led to believe we will have an oxygen tank available. But if you are feeling strain and you are having some difficulty, I'm not sure what the arrangement is, where the tank will be during our yatra, because some of the transport and the Sherpas may take things to the next camp in advance. They may not necessarily go around the mountain with us. So if you do need supplemental oxygen, which with a rebreather mask could push your oxygen levels. And yes, the concentrators may not give you 90% as they promise. They could give you 60% or 70%, but that's a hell of a lot more than the 8 to 10% oxygen you may get in the air in that environment, which is almost less than 50% of what you get at sea level in KZN. And please appreciate the change in oxygen availability to the body is not a straight line discussion. It's a logarithmic change. So that means every 1% change of oxygen availability to the body is a massive impact on the body, on how it needs to adjust its chemical systems, its blood flow to the brain and vital organ systems, of how it adjusts to the changes of the environment. Having supplemental oxygen, even between 2 or 3 family members or 4 or 5 people in a close family group, may be something that you want to consider. I've done the research, and the oxygen concentrators to rent for an entire month that are rechargeable are available from a supplier whose details I can provide to you, about 2.5 to 3,000 Rand for the entire month of September. And I cannot get involved in your rental of that process, but I can surely guide you the information. Is it a suggestion from everyone? No, it's not. This is a suggestion from me. Am I taking a machine along? I absolutely am, because I want to minimize any potential risks. The reality is we're all spending a large amount of money to travel on this trip, and the amount that it would cost to potentially rent a machine would be very closely aligned to the travel insurance that one may take. And I'd rather you use it on an oxygen machine than trigger using your travel insurance for an evacuation or otherwise. The aim of the supplemental oxygen is at that level, if you have any strain, even for an hour or two, or during an afternoon when you're recovering and saying, I am struggling with a bit of breathing, and you've not necessarily developed serious medical conditions. But with using a rebreather mask and sitting for an hour or two with this machine, you could potentially boost your body's vital reserves of oxygen and reduce the impact that the altitude may have. The machine, the batteries, I'm led to understand from the brochures and the companies that provide them, could run between 9 to 10 hours per machine. So it is possible, and I'm doing the same, is either carry an external battery charger that could charge the device, or potentially take a second battery, which, based on the information that I have, is about another 1,000 Rand. In reality, 3 to 3,500 Rand between 4 to 5 people may not be a huge amount of money. And yes, you may have to carry it or make an arrangement to have it in your backpack and let the pony guy, as some of us call it, or have somebody carry a few of these machines in a backpack for us. But in my personal view, I want to de-risk this trip as much as possible. We're all going here as individuals, as our own family groups. We're together as a community and a broader family on a spiritual journey. But I do think we need to also anticipate that whilst we're together, these risks may actively exist. I don't want to detract from many of you who've been doing aggressive training, but let's be realistic. One trek at 3,000 meters in an entire 2 months of training isn't going to get you ready. It only demonstrates your endurance for that period. For altitude symptoms to persist, you need to be in that environment for at least 12 hours and more. So short exposure with a high intensity training was absolutely awesome. I'm very proud of all of you having completed the training. But that does not detract from the risks. Once you cross 4,200 meters and we're reaching a maximum height of potentially 5,850 meters. Once you cross that barrier of more than 5,200 or 5,400 meters, you move into the very high, the extreme altitude environment, which itself is associated with significant risks. Yes, there are views amongst my learned peers who believe, well, it's for a short period. And my view is almost saying, well, putting your finger in a fire for half a second or 1 minute really doesn't make a difference. If it is preventable and something you can anticipate, let's consider, not compulsory, but consider the options of what we can do to prevent it. The reality is the medical team and 1 or 2 of my learned peers, my other 2 peers, may know some of you personally as patients. I don't. But collectively, I don't think we know everyone's background. And all I'm trying to anticipate is, if there's something preventable, if there's something treatable, if there's something we can anticipate, let's do it together, because we will be one family for a prolonged period in an extremely abnormal environment, in an extremely taxing environment, in a greatly spiritual environment. And I would want us to spend as much time as we can focusing on the spirituality and the joy of a potentially once-in-a-lifetime journey, whilst we de-risk any opportunity of every single person finishing the yatra and the parikrama together. I pray this reaches you with the greatest positive intent, and if there is a consideration by each of you within a particular group of people to carry a concentrator, I personally, this is my individual view again that I stress, think that it is a really good idea and I will be doing so. But I'd hate to have a situation where we're using a machine and you're in trouble, or your partner's in trouble, or your cousin's in trouble, and we only have one machine available, or we may have to then decide, although the oxygen tank's available, it may be a few kilometers away, and the reality is that tank is a large tank. It's not something that you're going to put under your arm and take with you for a few hours. You're going to have to stop the yatra at that point when you're needing that. And my belief is the oxygen tank under high pressure is meant strictly for an environment where you've got significant symptoms, and we need to treat and stop you in that yatra for that period to manage that. But if we can preventively manage an intervention whilst you continue in the yatra, I think it is a fair consideration. So I look forward to speaking to each of you. You have my number on the WhatsApp group. I'm happy to speak to you and speak to any of my colleagues if you want a similar or different view that we're traveling with us on the group. I pray everyone continues their training well, but let's be real about the risks and the concerns. And I pray that we all can mitigate all of the risks while we travel together in this once-in-a-lifetime journey. Stay well and stay blessed. Namaste.